Oh, modern medicine is marvellous, isn't it? With vaccines, we've eradicated diseases like smallpox. Antibiotics mean we no longer die from an infected flesh wound. And if it all gets too much for your poor organs, we can whip out a kidney or a heart and pop in a new one. Not like the old days, eh? Back then, things like bloodletting were all the rage. For centuries, it was believed that letting out the bad blood could cure anything from meningitis to madness. Pale and anemic? Let's open up a vein to fix you. Wrong! Always useless, frequently dangerous, even fatal. But it was only a couple of hundred years ago that we stopped doing it. Then, early last century, there was a fad for using a special water as a health tonic and to cure certain ailments such as impotence. Called Radiothor, it was, as its name suggests, radioactive. Also useless and certainly dangerous. Psychiatry has never been an exact science, but back in the 1930s, it was bordering on butchery. Lobotomy became a popular procedure. Well, popular amongst the psychiatrists, not so much the poor patients. In the absence of any other effective treatment, it was thought that severing the nerve pathways at the front of the brain might help diseases like schizophrenia. Frequently useless, often disastrous. But despite this, over 50,000 people in the US and the UK were lobotomized before the procedure was eventually abandoned. Wouldn't happen these days, would it? Well, maybe not to your brain, but what about your knee? For many years, orthopedic surgeons did arthroscopic surgery for osteoarthritis of the knee, until some bright spark came along and did a beautiful piece of research that showed that the surgery was no better than placebo. All those unnecessary operations, when a bit of time, physiotherapy and support would have worked just as well. Oh yes, modern medicine really is marvellous, except for the bits that turn out not to be. Unfortunately, neither you nor I know which those next bits might be.